Mae byw mewn ardal wledig yn gallu bod yn wych. Fodd bynnag, gall cael mynediad i'ch gwasanaethau iechyd a gofal fod yn heriol hefyd. Mae gofal ar lein yn cwmpasu amrywiaeth o wahanol wasanaethau gan gynnwys gysylltu gweithwyr iechyd proffesiynol a chleifion yn eu cartrefi eu hunain, gan gysylltu staff a chleifion o ysbytau lleol a wasanaethau arbenigol yn Ne Cymru, yn ogystal â defnyddio apiau neu wybodaeth ar lein i eich cefnogi'n well yn eich cymuned eich hun. Yn y ffilm fer hon, rydym yn egluro sut y gallai gofal ar lein fod yn ddefnyddiol I chi yn eich gwaith.
One of the problems that we have in a rural area is bringing patients and specialists together. Either patients travel substantial distances to see the expert or the expert travels substantial distances to see the patients. Obviously that consumes patient time, and if patients are unwell it may be difficult for them to travel. They may require transport from family or carers, which adds to the difficulty of getting to appointments.
Rhan fwyaf o'r gwaith dwi'n wneud gyda video conferencing ydy cwrdd yn wythnosol I drafod siwt mae cleifion a cancer yn cael eu trin, a mae'r timoedd I gyd yn dod at ei gilydd trwy video conferencing. Felly, oherwydd bod claf yn byw yng nghefn Gwlad Cymru fan hyn yn y canolbarth, mae fe dal yn mynd I cael y triniaeth fydde rhywun yn byw mewn dinas brysur yn agos iawn I ganolfan cancer mwy yn ei cael.
The iPads that we have at work are given to patients for a period of time, and I have an iPad at base. So that means that we can make contact with patients more regularly than maybe we would be able to if we had to drive to see them.
So one of the clinics that I run through telemedicine is in neurology. Periodically I meet with neurologists and we discuss cases of patients who might come to this hospital. So there is some support for me and there's some local expertise for patients when they do come here and better links with the specialist centres.
We would also be looking at the iPad to work using additional assisted technology with the use of apps.
I come across from the community mental health team and they've kindly allowed me to use their equipment because we have a client in common. This lady lives so far away, I would have been able to see her only once a month in person. Now we're using the iPad, I'm able to contact her weekly and more often if there is a need.
Patients have said and fed back to us that they have felt empowered by not having to make the journey, being able to have that support and service from the comfort of their own home.
Mae'r gwasanaeth yma wedi bod yn rhan hanfodol o'm triniaeth. Rwy'n byw mewn ardal wledig awr o Fronglais. Mae'r gwasanaeth hwn wedi caniatáu mi gyfathrebu yn rheolaidd gyda fy therapydd celf ac mae wedi fy alluogi I gadw pwyntiadau fyddwn ni wedi eu colli oherwydd ym mhroblemau symudol corfforol ac anallu I deithio.
Y cyfleustrau allu ddefnyddio'n syth heb yr holl trafferth o mynd i'r dre yw'r prif beth, a'r ffaith mod i'n gallu casglu y meddyliau a chael chydig funudau tawel ac yna bod yn syth I miwn iddo, yn ytrach na gorfod wneud yr holl yrru a pharco. Yn enwedig o gwmpas ysbyty, dwi ddim yn hawdd parco.
Beth mae fe'n golygu ydy nid yn unig bod y claf yn yr ardal wledig yn cael yr un triniaeth, cael gwared ar y postcode lottery, ond hefyd maen nhw yn gallu cael eu triniaeth yn agos I gatre ac yn wneud yn siŵr bod nhw ddim yn cael eu blino'r normodol wrth trafeilio ar hyd Cymru.
Over the last 6 months, I've been able to save, in terms of travel, over 1,000 miles. And in terms of hours, something like 5 days.
It's made the appointments much more accessible. It means that there's less pressure on me from my line manager because of time restraints, etc.
Dwi'n ei ddefnyddio yn aml iawn I allu lincio fewn I gyfarfodydd addysgiadol, ond hefyd cyfarfodydd lle mae siwt ni yn rhoi yr triniaethau gyd at ei gilydd ac yn wneud yn siŵr bod hwnna ar safon uchel yn cael ei creu o fewn y bwrdd iechyd.
We have specialist nurses and advanced nurse practitioners. We can have advanced practitioners in therapies, for example, who could also outreach in this way.
Using the iPad, it can mean that I don't have to travel 2 or 3 hours just to see one patient, so I can make better use of my clinical time. I've had patients of all different ages that are computer literate. As with anything, it's a tool. It's to be used appropriately with people. So it's gauging what's right for each patient on an individual basis.